Before entering the patient's room, I would check my orders and then also gather my supplies. Hi, my name's Stephanie. I'm going to be your student nurse today. We're going to go ahead and do a head-to-toe assessment. Let me wash my hands. Can I just verify your name and your birthday?
Jane Doe, January 1st, 2071.
Okay, and that's what we have here. I'm going to go ahead, make sure the bed's locked, put the rails up, raise the bed, close the curtain for privacy. Do you have any allergies?
No.
And then are you experiencing any pain?
No.
And then if you were, I would assess for quality, timing, if there was any provocative factors as well. And then also throughout the assessment, I would assess the vitals as needed. I'm going to go ahead and start with just a general skin exam, okay? I feel skin's warm to the touch. There's no cyanosis on the palms, finger beds, or lips. I'm going to go ahead and check mucous membranes. They are moist, no redness, no lesions. And I'm also going to pull up your skin here. And there's no tenting on the skin turgor. And then we're also going to check your bony prominences. Let me check under your elbows. No redness, no shearing. And then I'll also have you turn to your side. I'll check down your spine, your coccyx, sacrum, and then both heels back, which there are no redness. And then I would also know if there were any IVs, drains, which there are none. We'll also do a neurological exam. You gave me your name and your birth date. Do you know where you're at today?
The doctor's.
And then, do you know what year it is?
2020.
Okay, so speech is clear, and you're oriented to time and place and person. We'll go ahead and I'll do a strength test. All right, strength's equal on both sides. I'm gonna push, and then if you could just counteract me, okay? And I'm gonna pull, good. Also come down here and do the same with your feet. And push, good. Both sides are equal. I'm gonna wash my hands again. And then now, can you smile for me? And then will you stick out your tongue? All right, smile is symmetrical, tongue is midline. And now we'll check your pupils. Do you have any headaches, blurred vision, any ringing in the ears, tingling in the extremities or face?
No.
Okay. I'm going to check the reactive. Both pupils are about 4 millimeters, and they are round, equal, and accommodating. We'll check your accommodation right now. So just go ahead and follow us. Good. So round, equal, accommodating, and reactive to light. So now we will go ahead and move on to the sensory. I'll have you just close your eyes, and then I'm going to go ahead and touch certain areas, and if you would just let me know where I'm touching, okay?
Okay. My right hand, my left hand, left cheek, right foot, left foot, right cheek.
Okay, good. All right, we're going to move on to the cardio exam. Are you experiencing any chest pain?
No.
All right, let's go ahead and I'm going to check your capillary refill. Brisk refill within 3 seconds. And then I'm going to kind of have you sit up if you would. All right, and then extend your neck. I would look for any vein distension, and then I'll also be palpating the carotid artery on both sides. I'm going to say it's about a +2 on both sides. They're rhythmic. So you can go ahead and relax. And then I'm going to check your pedal pulses, the posterior tibial, and then your dorsal pietis. And both are both are equal and about a +2 in rhythmic. And then I also checked for edema. That would be on the ankle and the feet, which there are none on either foot. Now I'm gonna go ahead and listen to your heart. Alright, so 2 intercostal spaces down on the patient's right side would be the aortic valve. And then across on the left side, 2 intercostal spaces down would be the pulmonary valve. And then 4 intercostal spaces down would be tricuspid valve. And then 5th intercostal space, midline, is the mitral valve. Sorry. And there were no irregular sounds noted. All 4 areas are rhythmic. So we'll move on to the pulmonary. This, do you experience any shortness of breath, any pain on exertion, or any cough?
No.
And if you had a cough, then I would assess the sputum. Let's see. Can I have you breathe in through your mouth and take a couple deep breaths? Okay, and so no accessory muscles are being used, and then both sides of the chest rise and fall symmetrically. So I'm going to go ahead and take a listen. So I'm going to have you breathe in through your mouth and out through your mouth. I'm going to take a listen on the front of your chest, okay? Go ahead. Great, then I'm going to come under. Okay. Lung sounds are clear on both sides. I'm going to have you set up and then I'll listen Okay. And I'll just have you go ahead and lay back down. All lung sounds are clear. It's really good. And then we'll go ahead and do your abdominal assessment. So I'm going to have you, if you can tolerate, just bend your knees a little bit. And I am going to expose your abdomen if that's okay. And I'm going to take a listen really quick. Have you had any nausea, vomiting, diarrhea, constipation, any stomach pain?
No.
Okay. Okay. There were bowel sounds in all 4 quadrants. I would also note if there were any scars, lesions, or any asymmetricalness on your abdomen. Then I'm going to go ahead and palpate. Let me know if there's anything that bothers you, okay? Any pain or tenderness. And then I'll also check for your bladder distension, no rigidity, and it's not distended. All right. And then go ahead and lower the bed. Put the rails back down. Is there anything else that you need?
No.
All right, make sure the call light's in position, make sure you're comfortable, and then I'll go ahead, wash my hands, and document my findings.